Hello, everyone. My name is Dr. Justin Elikofer, and my partner and I, Dr. Guy Yatros, focus solely on treating patients for snoring and sleep apnea at New Concept Sleep. I'm joining you live today from doxy.me. This is a platform that we actually use to have free virtual consultations with our patients to tell them a little bit more about what we do. One of our biggest barriers in treatment for patients is that physicians and patients alike don't know that we exist. So, my goal today is to help share more information about what we do here at New Concept Sleep and really how I think we can help you. So, what I'm going to do here is I'm going to share my screen. And so, you should be able to see this here shortly. And then I'll go over a few quick tidbits of information for you and what I want to call my 5-minute consultation. The first thing I want to share with everyone is that sleep apnea is one of the most chronic, underdiagnosed medical conditions that lead to chronic daytime sleepiness, that cause snoring, fatigue, not sleeping well, and even depressed mood. We estimate that about 54 million people in the United States have sleep apnea. 40% of adult patients snore. The problem is we don't know about a large majority of these patients who have sleep apnea. We think that more than 80% of those patients are undiagnosed. And similarly to high blood pressure, obstructive sleep apnea for a long time was something we weren't looking for. Patients would often come into their physician's offices and say, "Hey, I don't feel good. I'm not sleeping well." And often the physician would think directly to depression. A lot of patients who have sleep apnea may be on antidepressant medications as well. Morning headaches, jaw pain, even acid reflux are all things that we see commonly in these patients. So, if any friends, family, or maybe yourself are experiencing any of these issues, definitely talk to your physician. There's definitely more testing that is going to be needed moving forward. When we start to look at what causes snoring and what causes sleep apnea, it's a result of the tongue and the jaw falling back on the airway repeatedly during the night. This can happen 5, 10, 15 times per hour, 30, even more. And so we use that number of times that the airway collapses to really grade the severity of obstructive sleep apnea. Partial collapse, also called a hypopnea, results in snoring, and complete collapse causes what we call an apnea or a cessation of breathing. So at nighttime, when we fall asleep, this is happening because our body is relaxing, our muscles relax. Um, they go limp at nighttime. And because our tongue is a muscle and because our jaw is a muscle, it can block the airway. So when we look at the treatment for snoring or sleep apnea, we want to open that airway. How can we open that airway? Well, one treatment option that's been around for a long time and a lot of people are familiar with is the CPAP. And CPAP stands for continuous positive airway pressure. And how CPAP works is it actually blows air up the nose, around the back of the throat, and inflates the airway. It pushes the tongue forward by inflating that airway. It's a very predictable procedure. A lot of physicians like it because we know for a large majority of patients, it will open the airway. Unfortunately, a lot of patients struggle with the wear time of the CPAP. Some even struggle to wear it just half the night. And we know that if we're not providing that treatment for the entire time of the night, we may not be treating the apnea as effectively as possible. So, a first line therapy and equally as effective a therapy for both mild and moderate sleep apnea is what we call an oral appliance. An oral appliance fits on the top and the bottom teeth, and they function to stabilize the lower mandible at nighttime, the lower jaw, so that the tongue and the jaw can't fall backwards. And if we can prevent this falling back of the jaw during sleep, we can often prevent snoring and help reduce the number of apneas or hypopneas that we're having per night. So, how do we decide I gave you a little bit more information just a second ago. We know that CPAP does a really good job at clearing the airway and opening the airway. The problem is patients aren't compliant, so they don't wear it enough. So when we actually look at the true effectiveness of CPAP therapy, we always have to consider how well a device works versus how often we're wearing it. Mandibular advancement, again, can be equally as effective for most patients because we can get patients to wear our devices longer. Our devices are more comfortable, and if we can win the war on wear time and compliance, then our devices can be equally as effective and in some cases even more effective than the CPAP for a large majority of patients. The devices overall are similar but different. All of the devices that we make here at our office are going to be custom made devices, both top and bottom trays. You can see that each one of these devices is going to have some sort of mechanism that is adjustable for these devices. These devices are adjustable for two reasons. One, we want the device to be as comfortable as possible day one that we start treatment. The second reason we want these devices to be adjustable is because we may need to adjust the lower jaw in a more forward position to increase the efficacy or how well the device works overall. And so you can see whether it's a strap or a band, a bracket here, maybe even a dorsal fin, a screw mechanism, or even a hook, they're all going to be adjustable so that they're both comfortable and because we can increase the effectiveness of the device overall. Our precision dental therapy takes it a step further by also monitoring your sleep apnea or your snoring at multiple different positions. You can see step one, if we were to get started in our office, is definitely going to be to take digital impressions. Step two, we know that patients who breathe well through their nose respond better to both treatments, whether CPAP, whether a dental device. We want to take a closer look inside your nasal cavity to make sure there's no obstructions or reasons that you can't breathe through your nose. Simply put, our noses are meant to breathe and our mouths are meant to eat. And so we want to make sure that these noses are clear as possible so that our treatment can become even more effective. Lastly, as I said earlier, our devices are all also adjustable so that we can increase the effectiveness. It's important to measure the jaw at multiple different positions throughout the evening, or throughout multiple nights rather, so that we can make our best educated guess on where your device is most effective. All of our studies done in our office will then be forwarded to a physician as well to confirm our findings. We as dentists work under the supervisions of physicians, so we would definitely want to get your physician not only on board, we will want to utilize them to help us diagnose you with obstructive sleep apnea, as well as, again, confirm any of our findings. So that's just a little bit about what we do here at New Concept Sleep. I hope this was informative. We still would like to meet with you and talk to you about your case specifically. We customize this treatment for everybody, really depending on their level of severity and their medical history overall. So it's still important that we meet with you. We also will build the insurance for this as well. And so we will talk to you about your specific insurance and costs associated with that at your free consultation as well. Again, thank you so much and have a good day. Again, this is Dr. Justin Elikofer and Dr. Guy Yatros at New Concept Sleep. If you're interested in more information, we have offices in Tampa, Bradenton, and Sarasota. And you can call 1-833-NO-SHEEP, or that's 1-833-667-4337 to schedule your free virtual consultation today.